Next slide, please. So I'm going to reinforce some of those messages that from Ali, and you can see CED partnered with WHO. We partnered with the Every Breath Counts Coalition and several of the entities within that, you know, the major NGOs around the world, the World Bank and so forth, you know, PATH, CHI, Build Health International. Next slide, Callie. So, you know, there were some incredible messages from these experts that over on the left, you know, this is Adriana talking, you know, we need, you know, clinical engineers in this oxygen game. Now that hasn't historically been our thing, but, you know, COVID brought added PPE, some involvement with IVD, as Dr. Sharma will speak about, our traditional medical equipment, digital health, but we added oxygen. And so we now need to look deeper into that. What's the role of of clinical engineers in global oxygen? You know, good quality, good monitoring, and using it for good care. We've got these new responsibilities we've got to step up. Adriana reminded us that, you know, there's funding agencies now able to get us the training we need. Yes, we know oxygen concentrators, but no, we don't know some of these other systems as well. Certainly some of our colleagues, I know Bangladesh is on the line, they're doing great things with PSA plants, and so are other places, but we need to go deeper as a community into that world, and we need to understand the oxygen ecosystem. You heard Ali talking about several sources that can provide oxygen along the levels of care, and the higher the acuity, you know, the greater the need. So we can join, as she said, planning and delivery committees at the local and the country levels to make a difference. Next slide, please. So some of the cool tools that are out there, you know, that we learned about back in May, are the ability to estimate oxygen needs, the ability to estimate oxygen costs. We realize those vary depending on the context and the location and so forth, but we can, you know, we've been doing this life cycle management, this planning, this understanding of all these, you know, different system views of things for a long time. Now we just need to apply that, you know, in our settings around oxygen. The clinical perspective there, this was from the doctor from Partners in Health out of Boston, US, that's working in what, 20, 30 countries around the world. Sorry if I got the number wrong, but we just see, you know, there's the sources of oxygen from the outside and then brought to the bedside in a variety of manners and then delivered to the patient through the various accessories appropriately. We, you know, the doctors focus on the bedside and the patient. We focus on the whole system. We can help make a difference there. Next slide. You know, once again, this is just echoing what Ali was saying, and what WHO has learned is we need trained, not only us, but the people that use these oxygen sources need to be trained well. And WHO, CED, and GCEA can help you in your countries. Global Clinical Engineering Alliance, IFMBE Clinical Engineering Division can help you work all that out. There needs to be the appropriate clinical protocols as well as the training around managing these sources. And we can, you know, it's not only the initial training. We know in our own careers, it's not just what we learn initially, it's how we have ongoing mentoring and how we have ongoing feedback and learning and troubleshooting tools along the way. So yeah, the whole thing, as the doctor said about his work in many countries, the right things, and talking about equipment and supplies in the right quantity at the right time. This is what we do. This is what we're good at. So we need to apply it to oxygen. Next, please. Yeah, so what was different about COVID and oxygen? Well, you see it particularly in the highest acuity settings, 2 to 6 times more oxygen in ICU for COVID. The demands are greater. And then the equipment needed, often if you're trying to source it at the time you need it, you know, you're going to be waiting. So how do we make the best of what we have already has been the strategy in several places. Next slide. And, you know, our friends from Build Health International, who work alongside Partners in Health, and maybe if you've ever heard of Dr. Paul Farmer in Haiti and other places, Rwanda, he's the key leader in the middle of that. But what has Build Health learned about oxygen? And I'm not going to read those things, but it's, you know, liquid oxygen is highly efficient, but you got to have good transportation, portable, oxygen concentrators matter in the lower acuity, but not necessarily in the higher. You need wall mounted pipes. You need number 4 is a huge: site planning, stable electricity, temperature control, parts supply chain, tools, hands-on training, all of that to make PSA work. And if you don't have all of that, it doesn't work well. And then it takes a lot to have the right strategy. So we can engage our global network and help our other engineering partners in low LMICs across the world. Next and last slide. So here's 3 ideas. For PSAs, we have the network and the platform to help facilitate global and local training alongside entities like Build Health International, and assist in that ongoing mentoring and spare parts needed alongside funding agencies. The funding agencies out there and I want to give us money to do this. I want to give WHO money to do this. We've got to step up and receive that and use it wisely. And we've got the network, CED and GCEA together. We've already started doing this in several countries. I think of Pakistan and Tazin's work there, our collaborator. We can work through the national societies, and we're trying to assist you in growing your societies. And, on the second day of the oxygen seminars, several of our colleagues, biomedical engineers, clinical engineers, in this case, IMRO and AFRO regions of the world are talked about how they're already making a huge difference. We can build on our colleagues' successes. And this is the time. We understand quality in clinical care delivery with safety. I'll just point out under these recent references, please go to the website, and I'll put the link in. I already did about this, but some recent references is the Every Breath Counts has a global PSA plant repair needs list. It's a lot of money and a lot of time to go get a new one. So you need to repair the existing ones. This is a list of several countries who have that need. And that's what a lot of the stakeholders are looking at now and trying to get the training and get this done. There's this global task force. I actually met with them yesterday, and they got the money. They want our help. We can do it. And we're working with our hospital engineer colleagues. Many of you know PSA plants involve things that we don't usually do every day, the piping and the plumbing and the electricity as much as they do, but we can work together. So next slide and last. Thank you. So oxygen, big topic. We tried to make it a little bit smaller, but it's still a big topic. We're going to cut now